Hello and welcome, Dr. Rob. How you doing? See My Fertility, welcome. And here to chat and talk about the rocky road of infertility. Here to answer your questions. Ananda, Danielle, welcome. And really, it's a welcome to all. And this is always a crazy process. Danielle, welcome. No one wants to be really, infertile. That's the interesting and crazy part to this. It sort of drags us in and drags us down. I'm here to answer questions, to share ideas, and Shauna Marie, Danielle, William, hello, Tanya, Vanna, Jessica, hello to all. And really, it's always a pleasure to be sharing and talking with everyone. And it's a challenge, and we've been hearing sort of the rumbles of unhappiness. And I've been working on some notes in the conversation of how to move through this crazy journey of infertility. And we had Aaron here a few weeks ago and talked about Fertile Hope Yoga and meditation and how to change it up. Again, I want to answer questions and share some ideas, and please bring me your questions, your thoughts, your ideas, your concerns. And I want everyone to know that I'm always available. And this is my passion, to be here on this crazy, crazy road. It's an irrational journey for sure. The instinct makes us get sad, depressed, angry, worried, fearful, and it's like someone cuts us off in traffic, and sometimes we gotta yell and scream and, whoa, crazy. Hey, Deborah, Erica, hello to all, and from Ohio and from everywhere. Again, we're really grateful to all those that are sharing the story, but it isn't always positive. And one of the things I've learned about this fertility journey is sometimes, at least with IVF, it acts as a little bit of a diagnostic tool that sometimes we don't get fertilization, we don't get eggs, we don't get embryos, we don't get a transfer, we don't get frozens, and we don't get pregnant. Or if we get pregnant, we get a miscarriage. And recently, I had someone with a normal PGS tested embryo have a miscarriage and found that it was PGS abnormal. Crazy. Because the questions we're always asking aren't always answered very succinctly, truthfully, or in a way that we all can know what to do and which way to go. Crystal, the dreaded rocky infertility road, maybe that's kind of what we should be talking about. And I know sometimes I lash out when I get sad or mad or angry, and so we lash out to the people we love, friends, family, to all of us. And it's hard, and our job is to stand true with you, even in those moments of anger and worry and fear and regret and judgment. And we're always here to listen, to learn how to do better and be better. And for those of us for those out there that haven't been with CMI Fertility, we welcome you to ask us the questions, the hard ones. What's going on? Why would anyone want to be on this journey? Or why would someone be unhappy with what we're doing? And I'm always here to try to answer them. It's personal and it's private for each of you. And that's what we want to make sure you know that. And it's not just me, we have a huge number of nurses and practitioners that want to be on your personal journey to help you. And my cell number is 315-416-9872. And if there's a problem with anything, you come to me, and I'm always here. And Justine Taylor, one of our great nurses, along with Donna, really an amazing team that is here to listen and help you when it's the worst of the worst, the pain of the pain, the hardest of the hard. And part of what I'm always working to do is how can we share love? listen more. And it's really a heartfelt journey that I think we all want to remember. And Tiffany Reader Wood, how are you doing? How do I get my egg quality better? It seems to be a problem for so many of us, but it's eggs and sperm. It's our gametes, it's our testicles, it's our ovaries. It's all this stuff going on in there. And the question is how to improve it. We've talked a lot about diet and keto, paleo. And remember, vegan, vegetarians, there's always a way to find that. DHEA, CoQ10, fish oil, slow it down. I really believe that endometriosis is a major cause of the inflammation in our bellies. It comes from the gut. And in some cases, laparoscopy, hysteroscopy can help find that. What do you put in your mind and what do you put in your mouth, and how can visualizing, and years ago I read The Secret by Rhonda Byrne, and then we wrote a book called The Fertile Secret, how we can change what is in our mind, because so often we can be dragged down in this social media stuff, but we're obviously out here trying to pull us all up and maybe send out the lifeline when it seems like, oh my God, nothing can work here. And we've seen it, and we want to hear the stories when after years and years of failure, it either just happened naturally or with some of the things that we're all sharing together. And whenever we're seeing someone that is really looks like they're really losing it, and the anger, the fear, the worry, how can we all come together as that village and be supportive and kind and listen and learn and come back? So, Tiffany, I hope I've helped. And I talk so much about the 5 causes of disease. Glucose, it's all the fruits, fiber, vegetables, too much, and lean meat. It's the plant antigens, it's the plant phytochemicals, it's the fermentation in their gut, and it's all too much exercise. And I know it sounds so crazy, but it works. Kelly Wilson, how you doing? Andrea Singleton, best way to thicken up the lining and quickly reduce inflammation in the gut, massage, acupuncture, yoga, infrared light pads, and I'm talking more about low-dose naltrexone and CBD oil, estrogen, oral vaginal patch or shots, and more we're looking towards Viagra and Cialis, and even intrauterine and sub-Q Neupogen will help a lot. And it's likely worthwhile a 2 to 4 week course of antibiotics, Doxy, Z-Pak, maybe in bigger, Levaquin or Cipro. So at times it may be worth looking at the endometrial biopsy, but sometimes just empiric therapy, I think it's really, really helpful. And hi, Beth Orlowski Anderson, really welcome. And Kelly Wilson, hello back to you. Let's see, does keto increase your chances for a frozen embryo transfer? Remember, keto is king for everything. Any disease you're suffering from, autoimmune inflammation, it really, really helps. And remember, Maria Emmerich, look at Maria's stuff. Maria is going to be joining us in September. We'll get the date out to you. Please share it around. We think it really is powerful. And I know, remember, it's the what are you dreaming about? And if it's negative and bringing you down, you got to work to focus on the clear view of the baby, the family, the vision boarding, and do it in keto. And I'm always going to work on showing Maria's stuff, and she's got some really great stuff. Maria Emmerich, and join Maria and befriend her. And remember, we're all sharing what's right, what's wrong, what can we do and improve on. So, and she has a comfort foods. And remember, a shared positive word or love and a hug is powerful. And listening more and more. I kind of go like this, not loser. Remember, love, listen, learn. That's what we're all working to do. Really big. Allison, Allison, Stephanie, Liz, and Kim, our donor team, really awesome, grateful. Ashley Battles, how you doing? Melissa Anderson, really a pleasure for everyone. And I'm working to get to everyone. I'm always apologetic. Remember, if anything we're doing wrong, I'm not getting to you, send it my way. Kiltz at cmyfertility.com. And don't forget to use your portal, send us correspondence. And if you're not hearing from us, come back and ask and make sure we're getting it. And I'm gonna try to get up and down on all of this. And let's see. Hi, Kristen Green. How you doing? Crystal Schaefer. Let's see. Thankful heart to help everyone. And we're here to do that. And remember, we've seen so many failures, success. And sometimes it seems like a huge flop. And if for some reason, whatever advice we may have given you and it looks like it's just made a complete flop, we're here to make it better. But we got to talk about it. We've got to talk about it. It's really, really important on this journey. And we have ways to help on the financial side and help to find medications. And remember, if you failed after 3, we have a great discount for the 4th cycle. And our donor egg add-on is really much more affordable than full payment plans. But remember, it's not just affordability. We really want to be talking about quality, access, and all sorts of it. So Katrina Collins, success at last. And remember, once you're pregnant, you can't give up on reaching out for positivity, reaching out for love and guidance and care. Stay keto throughout your pregnancy. I believe it's a life plan. It reduces inflammation. And remember, inflammation screws up the brain. I was watching the show today a little bit on these devices like the Assure implant and hip implants, where there's all these metals that we're likely allergic to, and you have to wonder if the heavy metals are in the food we're eating, which may be contributing a tremendous amount to our inflammation. And I know that Maria has a cleansing 30-day plan, and I really, really recommend it. I think it's so powerful for everyone. And remember, we're not just talking about infertility. We're talking about hypertension, diabetes, cancer, stroke, everything. And again, when we share the support stories, and I know, sometimes it's interesting. Most people never show up for this journey, and no one really wants to come see Dr. Kiltz or see My Fertility for any of this. We want to run for the hills, and then we want to lash out at everyone in the world who just doesn't understand our problem. Don't we all? And I've done it too in so many ways. We're here to give hope where hope seems like it's lost. And remember, for those that are seem to be losing hope, our job as a community is bring love to the story, bring love to the people out there, to all of us, because in this human environment, this human story, it seems like politics and religion and relationships are really beating us, driving us down. But we're here to show love and kindness always out there. And so this is how we learn. So loves and likes. And remember, we're here when it's not working. And we've seen so many have failed. And I talked to one of our clients today where she had 11 embryos with us, trying someone else right now, got nothing. And still reaching out that we're here to help wherever she's going and learning from the process. That's what we're all here to do. And somehow when there's a failure, we have to have faith. And faith is powerful. It's belief in the dream you hold. Don't let it go. Hey, Sarah, Yurka, how you doing? And Kristen Felsen, always a pleasure to all. And The Secret. Yes, The Fertile Secret. And I must say that Rhonda Byrne, I loved her book, The Secret. And so I took and made The Fertile Secret, because we are fertile in our lives in so many ways. And remember, the real blessing is that any of us were born at all. It doesn't matter how you're born and in what circumstances. And ultimately, there's a higher power that is guiding us on this journey, even when it's down and depressing and sad and angry. Whoa. Emotions and the hormones of this process will drive us to, like, you know what, we shoot, we throw, and it's shoot first, ask questions later. But at CNY Fertility and CNY Healing Arts, we all want to come up at a higher level. And probably around 10, 15 years ago, I created a website called mindbodysmile.com. It's still there. I'm not contributing to as much as I used to, but it's about meditation, prayer, yoga, and the positive of our lives. Because it doesn't matter what negative you're experiencing. And I know it's hurtful when someone throws something at you or any of us. How can we stand still and love and forgive and hold judgment of love? Remember, no judgment. Typically, our judgment is negative and down, and we want to bring it up. All right. Lisa Cohen, how you doing? All right. 28 PCOS, failed IVF twice, only one embryo to transfer out of 44 eggs. Wow. Kicker is I have 3 children from IUI, did IVF for PGS. Yes. What went wrong? And this is the hardest part. Is it something has changed as we get older? The inflammation adds on. Could it have been a protocol problem where it was too high a dose or too low a dose? We didn't add enough human growth hormone, maybe a little bit more Menopur to the process. Maybe we have to add that HCG for trigger. So these are the things that come into play. Plus, for so many, for some reason, they don't make blastocyst embryos in the lab because for some reason that culture media may not be perfect for you. So sometimes we can't get to the day 5, 6, or 7 PGS process for biopsy. And sometimes you have to figure out how to do a day 3 biopsy, yet fewer and fewer programs are able to test that way. So, one is keto, laparoscopy with ovarian drilling or acupuncture. Remember the supplements, Ovasitol, Ovavite, Theramegas, the omega-3 fatty acids, and I've been playing a lot with hemp seed oil, no THC, which has a lot of omega-3s, and those are really the healthy things. And it's fat that we must be consuming, and we give intravenous fat to lower inflammation, to help improve your fertility. And remember, it's all happening in the bucket, the bellies, the bowels, and that's where it's all going on. And I tell people, do not do carbs, fruit, fiber, vegetables in any significant fashion, or make sure you're separating them 12 to 24 hours apart. And I call it intermittent feasting, 1 meal a day or less. So maybe, oh, by the way, on Lisa, you did human growth, don't do it again. Some people were finding that human growth isn't the very best. But I hope I answered some of those questions. Sam, InvoCells, InvoCell was really created to try to mimic a lower cost, but we're already lower cost. So we haven't had many takers on that. I know that some other people are doing it from Texas, and I apologize, I don't recall the names right away, but if you want to do it, we'd be glad to help. It's just another culture dish that goes in the vagina and cultures for 3 to 5 to 6 days. It's another option for you. Let's see, Catherine Hawes, we're looking forward to seeing you. Malou Fantone, how you doing? An alternative for Lupron Depot for adenomyosis. So you can do the sub-Q Lupron, 10 to 20 units a day for 1 to 3 months, because the Depot Lupron is way too expensive. Plus, if you've given the 1 shot IM, you can't reverse it easily, where you can always stop the sub-Q shot. So adenomyosis is really a tough one, but I also believe that adenomyosis is simply inflammation from gut disease. That's really important to see. So Mandy Rastares, how you doing? AMH was 0.6, now it's 1.1. 1 egg, first IVF cycle, hoping to do better. So remember, reducing inflammation in the body, LDN, CBD, keto, slow it down, no exercise, cool it down, cool plunges. And I know Maria in her keto book talks about cooling the body, real important. And we've seen AMHs come up, FSHs go down. And even at 44, I've seen where we got no eggs, spontaneous pregnancy. So listen, I didn't believe any of this. And I talk about it incessantly, I know. So it's really, really, really amazing. And Jennifer Carabas, how you doing? Angelica Johnson, get my embryos to stick. Endometrial biopsy, hysteroscopy, DNC, antibiotics, intrauterine Neupogen, HCG, sub-Q Neupogen, and don't forget the immune protocol, intralipids, Lovenox, prednisone, Prograf or Plaquenil, and then the bigger guns are IVIG and Humira. We really think they're valuable. Slow it down. Massage, light therapy really, really, really helps, I believe. So I hope I'm answering some good questions here. Again, I'm really appreciative. And Will and I were talking about how to get maybe some input, some live discussion on the stresses and strains of the infertility journey. And so maybe next week we'll bring something live on for everyone. And Kristen Grubb, LDN, yes, I think it's really helpful. 3 to 4.5 milligrams, although we've had some people that don't tolerate it for some reason. Take it at night, think it's helpful. And I always forget to talk about the antihistamine protocol for implantation, which is Claritin in the morning, Peps in the afternoon, and Benadryl at night, starting beginning of the cycle, and the Benadryl starting with the progesterone. We think it really can help with implantation. So, there's a lot of things that we're finding that there's not a lot of straightforward data to be able to answer the question, but there's a lot of empiric evidence, and that's what we're all sharing here. The empiric evidence of positive approach, the fertile secret, and how to do better. Let's see, Marlene Dietrich Wieck, recommendations on how to get rid of the keto flu symptoms, bone broth. I do coffee, dark coffee with butter. I think it helps. And go slow. A little paleo at first may be helpful. Read Maria Emmerich stuff, really valuable. And check out Gary Taub's Good Calories, Bad Calories. Listen to these books. They've really helped me tremendously. And Jack Canfield in The Success Principles, The Secret. I'm a big, I know who. Okay. Lindsay Eastburn, her husband and son came and visited from Colorado. Really grateful, talking about how hypnosis, and again, it's reshaping the instinctual brain. It's not our consciousness, it's our subconscious mind. And that's what we're working on. And that's one of the problems I'm finding with our negative social media and our negative thinking. It actually gets into the subconscious minds and keeps us in a negative, high cortisol, high epinephrine, fear and worry. And it doesn't reshape the hormones and reshape the blood flow because you want to calm it down. Really, really helpful in this process. And don't forget, we're here to share the approach of natural conception, IUIs, IVF, assisted, donor eggs, donor embryos, donor sperm, a gestational carrier, laparoscopy, hysteroscopy, and simply meditation, yoga. And our CNY Healing Arts team is really amazing. And again, we're really, really, really grateful to everyone out there. Let's see. Hey, Megan Dragluski, how you doing? How long after a miscarriage is recommended before going for another transfer? 6 to 8 weeks is probably the earliest, but I have some that have a very early loss. In 2 weeks, their HCG is negative. We can start them on the journey with either a natural cycle, letrozole clomid, or medicated with estrogen and progesterone. We think it will get you moving forward. And don't forget, talk about de-stressing. What can my daily practices be? My mind, body, smile always started, and this is what I do every day. I start the early morning with the prayer and meditation. On my half an hour drive to the office, which I start at about 4:30, I'm always listening to inspiring book or story. That's what we really want to be focusing ourselves on. And so many things are trying to catch us into the negative. Remember, let it go. We want to follow the energy of positivity as much as we can because we want to change the mindset. That's what this is about. Hey, Tammy Dupree, and again, I'm sort of just randomly going here. I really apologize. Do you do a different protocol for Hashimoto? So anything that's an autoimmune disorder, you really want to be focusing on the global immunologic process. Make sure the thyroid function is normal. Check the prolactin also. We seem to finding that for some people, hyperprolactinemia may be part of the culprit. But most of all, this thyroid gland gets us crazy. And for so many, we've seen where they've had it removed a lot of the immunologic processes going on. So that may be helpful. So make sure it may be worth getting an ultrasound of the thyroid, looking for any cysts or anything else. But really important to follow an autoimmune protocol. And I always call it's antihistamine, it's intralipids, Lovenox, prednisone. So there's a lot of parts to this immune protocol. And if you send me an email, I'll be glad to send you the letter I've been talking about and sharing my 5 causes of all diseases. And infertility, obviously, is just another one of the common diseases that we seem to be suffering from. Rachel McMullen, how you doing? And again, I see the conversations amongst the family. And sometimes our family members can get a little unruly. And again, let's learn and listen from each of us, and let's be supportive. And let's see, a lot of meat replacements. One of the things I don't like all these box and package things. And the more fresh and organic we can find, better. The more paleo is top of the garden. Fresh fatty meats, fresh fatty fish. I really recommend the separating your meals as much as you can. And again, back to Maria, we really support her way. She's really, really awesome. Harmony de la Cruz, how are you doing? Let's see. Tony Lynn, Romolo Sturk, how you doing? DOR AMH of 0.254. Retrieval in the next few days. Went gluten-free, clean eating. So remember, wash the food, but I really believe you got to go past just gluten-free. You really got to, I just get rid of all those carbs as much as you can. Fruits, vegetables, fiber, bad, but cook them down, eliminate the grains, the pasta, the rice, the breads, the yogurt, the milk. And Anna Miles, how are you doing? And absolutely, for guys, by doing all the things that we're talking about, you're removing inflammation in the gut, that it removes inflammation in the testes, which improves morphology. Cool the testes down, slow it down, and the same things, yoga, meditation, prayer, spirituality, good positive intent in the brain. And those, all the same things are going to help for sure. Jessica Stripling, both tubes removed due to multiple ectopics. Remember, ectopics are from intra-abdominal pelvic inflammation. The saline sonogram, it could be helpful to look in the cavity, or a hysteroscopy, making sure there's nothing else going on in the cavity, but it's not empiric. It's not imperative that you do that. It's trying to cover all the bases here. That's what we're really working to do. Brandy, hi there. FSH go from 5.6 in May to 28.9 in July. Inflammation, and it's kind of like we get these inflammatory diseases, almost like the keto flu. These viruses or other inflammatory processes, heavy metals and all these things may be the culprit that's just it's getting into our bloodstream, into our lymphatics, and into the interstitial spaces, and it's being deposited everywhere. And the thyroid, the adrenals, the ovaries, the testes are highly sensitive. And I'm seeing these diseases happening at younger and younger and younger ages. My bet is so much of it is happening intrauterine. Please share the words, and we really appreciate the likes, the love, the sharing, and we're really on this journey all together. That we're all going to uplift the story and the whole family here. It's a neighborhood, and again, no one chooses to be on this. No one chooses to have all these diseases and be infertile, and it's hard. The majority of those that are afflicted by infertility never show up for this story. They never seek fertility assistance, and we're hopeful that as we share the story more and more, even when it brings out the craziness in us, we're able to help us find a calmness that allows us to live a joyful existence even when it doesn't happen, or if it doesn't happen, or you're able to find a way to find adoption, or helping someone with a child, or helping someone else in this journey, or finding the success that you joy and journey for. All right. Heavy metal detox. Good question, Kim McCurry. And I think keto really is critical. A cleansing diet is great. And I know there's a lot out there about high vitamin C, vitamin D levels. Watch the water and the things you're drinking and eating, really powerful and helpful in that. And I think that's something we need to look at. chelating agents. I'm not an expert at this, but it's also amazing things that we really need to talk about. And again, I'm grateful. Share the conversation. Again, even if it's someone that is not infertile, but they're thinking about having a child in the next few years, and or someone that's interested in donating their eggs or their sperm or their embryos. And we're really asking anyone out there that has embryos that are on ice, that not sure what to do with. How do we as a family share our embryos, share your embryos to help build a family, your eggs, your sperm, your medications, or whatever you're out there doing to help in the process, because it is hard. Laura Wilson, hi. It's a miracle out there. Donor embryos. So ask. That's what we all need to be doing, asking more. And hi, Jessica Stripling, how you doing? 35, chronic arthritis. Remember, it's just systemic inflammation. That's what's going on. Hips, spine, knees, keto, and daily detox, and not constantly ache. And it goes away, all of this. It's crazy, amazing. And I say this is a life plan, and I've seen so many, diabetes gone, hypertension gone, irritable bowel, colitis, migraines, arthritis, all goes away. You're going to lose 25, 50, 100 pounds, even when you don't need to lose all of that. You're going to get lean and feel fit, and your brain works better. My bet is when the brain is, going nuts, it's because of heavy metals, inflammation, glucose, plant antigens, plant phytochemicals. Then it's really quite amazing. And on this challenging episodes, another round of IVF in the near future. And sometimes you need a break. And we often do back-to-back retrievals to bank some embryos, bank some eggs. But the roller coaster is scary, hard, fearful, worrisome. And take a break. Go on a trip. Silence. Today I was just sitting out by the lake reading. I'm reading a book on ancient Native American herbs and herbal treatments and treatments that have been around for thousands of years. Very helpful. Because none of this stuff we're talking about is really new. And, we human beings are kind of always butting heads. And even us in medicine, my team members, all of us, we all from time to time feel it. And we want you to know that we're here no matter what. Let's see. Natty Burford, I would love a medications package or a cookbook. Well, remember, the cookbook for keto is Marie Emmerich. She's amazing. Check out Jimmy Moore, Andres Seinfeld, Edith Davis. There's just so many out there that have shared so much. And we should be sharing our recipes for success. All right. Morgan Kimmick, how you doing? Acupuncture and fertility. So, touch, electrical energy is flowing through all of us. And really, this is probably just an electrical energy experience. And these electrical forces bring things together and push things apart. And acupuncture, like massage, essential oils on the skin, all likely realign the energy and find those areas that are hurting. And the pelvis, the temples, the extremities, the back, all areas need that love. And when I've done acupuncture for myself to de-stress and find a new way, it's really helpful. We at See My Healing Arts, See My Fertility have lots of experts, but there are so many people out there that are providing great acupuncture care. I think for men and women, it can help elevate AMHs and improve blood flow, because it's really all blood flow. And somehow when you get frightened and the fight or flight energy kicks in, there's an electrical impulse that probably happens faster than anything we know. And so it can be very helpful. Traditional Chinese medicine through acupuncture, herbs, looking at the tongue, and somehow it all shows up deep inside there. And remember, our fear and worry show right away. And we really want to help and make sure we're able to come to the table and help you. Let's see. Meat replacements. I'm not against sodium, by the way. Salt is good for us. We need it. And the vegan keto Facebook group, I think, again, vegan and vegetarians, you just have to do it a little bit differently. The coconut oil, coconut fat. If you're a vegetarian, it's butter, cream, eggs. And I believe that the fiber in the foods is not good for us. And read Fiber Menace. It really is helpful. But you got to reduce the carbs, separate them out, 1 to 2 meals a day, 12 to 24 hours. You shouldn't be eating in a 5-hour window. Have your meal. You convert it to fat. That's how we run, always on fat. And Vicki Mullins, how you doing? Always a pleasure. Jeff Noss, DigiHive, we really a shout out. And Vicki has really been helping us with our essential oils, and we're so grateful to Vicki for that. And Shambria Cruz, Isha Rogers, how you doing? Erica, we did the autoimmune protocol, first round IVF. I know to do keto. Should we tweak it for round 2? We'll look at that. And, you can add IVIG, Humira, leukocyte immunotransfusion, LIT, Markham Fertility in Toronto or Nogales, Mexico. I know it sounds crazy, but somehow the treatment with the male partners, white blood cells helps. Mirabelle Viridalis, we're working on Atlanta. We're working on PRP therapy. And the ERA, we think it can be helpful. Not across the board for everyone, but we do think it can be helpful. And we're working with Shore Fertility, Alan Morgan in New Jersey, and also with others out there. You know, we'll work with your OBGYNs across the country and the world. We'll work with your practitioners to help you get more affordable monitoring, meds, and the whole process. And again, I talk a lot about laparoscopy, hysteroscopy for endometriosis and pelvic adhesions. I think it can be very, very, very helpful. Lindsay Vandergriff, how you doing? MTHFR, factor V Leiden, PCOS, any insight for the next retrieval? So, elevated homocysteine levels, MTHFR, factor V Leiden, and even PCOS are all metabolic inflammatory conditions. And treating with Lovenox, aspirin, possibly steroids, the triplet, but you got to be careful. There's some potential side effects. And looking more at a global immunologic treatment, Neupogen, intralipids, IVIG, Plaquenil, and there's some empiric treatment here. It's hard to find the prospective randomized studies. They aren't there very well. That's one of the hard parts to this. And I'm out in Buffalo this week, in Rochester Wednesday. And, you know, I really enjoy the conversations, the communication back and forth. You know, share the struggles, share the challenges, reach out for help. Or if you're noticing the pain, reach out and share the love and the help for each of us. And Rosina Richard, all right, 60 on that first, 138. Now remember, that second HCG is going to go up greater than 1.5. That's what we like to see. If it's not, we don't always know. You got to continue to follow it. And we recommend weekly ultrasounds, and we're working on sort of a global approach to your early pregnancy care, even into the second and third trimesters, anti-inflammation. So it's really, really, really helpful in all of this. Mary Lou Fantone, how you doing? How do I know I need a surrogate without losing another pregnancy? Adenomyosis. Well, it's not always easy to know if you need a surrogate, a gestational carrier, another uterus, really. Adenomyosis can be pretty bad and not always easy to treat, but if you've used IVIG, Humira, and nothing's working, look towards the surrogate. And sometimes we've had where we've transferred both into the patient and the surrogate, and we've got success both ways. So again, we don't always know, and sometimes it's just a matter of checking it out. And V Mullins at cnyfertility.com, Vicky's sharing it out. Anyone is interested in essential oils, we're talking more about CBD and how hemp oil is really an essential oil. Tremendous anti-inflammatory along with the LDN, so I think it's real important in the process. And again, if you're reaching out and working with another fertility doctor, we're here to work with you also and help you on that journey. So we've seen so many that we've all working as a team approach, and that's what we really want to be doing here. It's a team approach in all ways that I can see. And Courtney Grinfield Fabio, LAP stage 3 endo, start September. And Atlanta's coming. We're hoping September. Be patient. You know, we put it out there mentally. The dream is open. It's going to happen. So we know it's happening. And a shout out for our Buffalo and Rochester and Albany teams. Amazing. Grateful for Dr. Ditkoff, Grossman, Corley. Dr. Ann Wold is joining us soon. And really, again, to everyone, we're so grateful. Let's see. Christina Copley, how you doing? Dr. K, how long do you think it takes to see benefits from keto CBD? 2 to 4 weeks, maybe all it takes. But, you know, it's a hard one. When something doesn't work, we want to run away. You know, we want to have a cheat day. Okay, from time to time. But you'll notice how you're going to feel miserable from that. But for 2 to 4 weeks, it should, and I've seen it so fast. But don't give up. It may take 6 months or a year. If what you want isn't working, don't give up. Don't give up. Don't give up. Real important. So, and let's see. Okay. Angie, how you doing? 3 egg retrievals, 50 eggs, 5 made it to blast, PGS, all chromosomally abnormal. Don't give up. You know, these chromosomally abnormal blasts may not be as accurate as we think they are. Recently had a normal PGS embryo, had a miscarriage and was abnormal. And everyone's going to find some reason for something, but we're not very good at it. It may be worthwhile transferring day 3s, I believe. I believe that a lot of the abnormalities actually happen after ovulation, after the sperm production. It may be happening on the journey, in the tubes, in the uterus, in the vagina, all these places. The body's immune system it's just dust. It's so much dust and particles being thrown at us. It's like our crazy negative words when we throw it out there. Man, it hits us like a Mack truck and we want to run or we want to fight it. Inflammation. It's all it is. And remember, we can change it up. So don't give up. But remember, maybe it's the sperm. Maybe it's the egg. You got to think about an egg donor, a sperm donor, an embryo donor, or remember, what things can we do to change the process? You're getting a lot of eggs, maybe a more natural cycle, lower doses, or just doing a Clomid or letrozole trigger, a mini. These are things that I always say, if what you're doing isn't working, you have to do something else. And if it doesn't work once and you run for the hills, keep going. I was playing golf this morning with my buddies, and I really go just to hang out with them. NATO golf, not attached to outcomes. 6:50 in the morning, we have coffee, and I missed the downhill putt 20 feet, but I got the 20-foot uphill putt. Who knows? Somehow that uphill, it's the pain pushes us until somehow the light pulls us. And I know there's light when it seems like the darkest day. As they say, the darkest time is the dawn just before the light. Don't give up. Check out The Fertile Secret on Amazon and share your stories. Share your success stories after you feel like you've been beaten down. Let's see, inflammation in the knee, feet, hips, all of that inflammation that you're feeling in the knee, the feet, the hips is everywhere. And I was watching this Netflix show on devices and how the hip transplants, these devices had cobalt. And it affected the brain and every part of the body. And so we have to know and imagine that so much of what we put in or on our body where we breathe is affecting every single nook and cranny of our body. That's the craziness. And I'm only learning from what I'm reading and listening to. And really, when we hear these stories, we have to take a moment and think, well, how does this all fit in? Ashley, a pleasure, casino, and we're all visualizing a win for everyone, however the win happens, whether it's natural, with us, with someone else. We are praying for that win, however it happens. And hey, Penny Fantagrossi, how you doing? Fantagrossi, 3 losses. We're all going to put our energy together and visualize success for each and every one of you. And even for those that haven't connected on the CNY fertility journey, that we're sharing and visualizing that success. And I've seen it when you least expect it, when you just give up, when you run away, when the heart of hard hits you. Smiling, remember that. All right. Hey, Blair Porter Hornbacher, how you doing? Keto 4 weeks. Awesome. Keep going. You're feeling a difference. Inflammation in the neck, shoulders, hips. And I'm hoping that means it's getting better. Sometimes if what you're doing isn't working, you gotta keep a journal. And I highly recommend journal the story. And I think for so many, this is our journal. the blogging or the messaging, how bad it is and how rotten it is. And we're open to that and we know it. And what we really want to be saying is how can we all help when it seems so bad? I do a lot of spiritual reading, texts, the Bhagavad Gita, the New and Old Testaments, the Quran, Tao Te Ching, and where we're reading these things, we realize that somehow the word and the words we're using in our brain, they're really just sending signals to every nook and cranny of our body. They can adversely or positively affect our eggs, our sperm, our coronaries, our bowels. Oh my gosh, craziness, I know. Blair, I'm glad, getting better. Benadryl and implantation. Christina Tate, yes. So we haven't used it very much. We're just working on the antihistamine protocol, but it's Claritin in the morning, Pepsi in the afternoon, and Benadryl at night. And we don't know the exact doses on that, but Benadryl 50 at night, and then the Pepsi in afternoon and Claritin in the morning. 1 to 2 weeks around transfer, not for a long time. Maybe it's going to help also for people attempting pregnancy naturally, because no matter what we're doing for the IVF process, I believe so many of these things are going to help when it comes to even natural processes. All right, let's see. Hey, Kim McCurry, how you doing? Haven't had an issue getting baby to stick. Neupogen is really focused. Let's see here. And I'm seeing there's probably some conversations going on internally, and I apologize if I'm missing some of them since these come in at different times. Katie Gratage, 6 chemicals, trying to stay positive. Yes, keep at it. My brother Ray always said, keep at it, keep at it, keep at it. And I am practicing a positive approach to my day. A little bit of this and a lot of this. And it really is, we're all working that this is a rainbow. And remember, it goes from the dark to the light. It encompasses the positive and negative. And you can't have one without the other. And maybe that's the part that we're learning in whatever's being shared and how it's being shared, and whoever's sharing it, we're grateful to the sharing. And please bring it on more and more and more, because we want to then capture that. Remember, all in love. The love is so powerful. Twin boys, twin boys, 3 weeks, amazing. Kristen, how are you doing? Let's see here. Kristen Raup, sperm quality issues. Best pest samples were done at the end of doing Maria's 30-day keto cleanse. Remember, check out Maria's keto books. You can go to our website and go directly to her site. We didn't continue to follow the program after that. Back down for the next 2 samples. Oh, listen, this is a life plan. This whole conversation, this somehow I imagine whatever happens to me as a gift, a present. Remember, it's a present that we can't open. Sometimes it smells bad, but remember, the SHI crazy stuff smells bad because it's the fertilizer for our lives and everything we're going on here. And you got to stay keto. And once you're pregnant, keto is so powerful and amazing. I know your doctors are going to tell you, no, you got to eat plenty of fruits and vegetables. They are deadly for your baby. It is nuts. I believe that morning sickness, nausea, and vomiting is saying, do not put that poisonous stuff in that amazing Ferrari of yours. And we are more valuable, more expensive, and more irreplaceable than a Ferrari. We must begin to treat our bodies like a Ferrari, not a Yugo, a lion, not a pig. And I know it sounds crazy. And again, I'm really enjoying this whole conversation. Again, let's go with it. Hey, Tammy, let's see. How do you work with our current? Listen, talk to your docs at your current clinics. We're here to help you and them. We believe that affordability is helping enlarge the people that are able to utilize the services everywhere. And remember, we have full payment plans. It doesn't matter what your credit is. We're here to help you on the journey. By the way, Angela, turmeric for inflammation, CBD, LDN. I really recommend stay away from too many spices. They may be very inflammatory and you may be allergic to it and you and I don't even know it. So less is best and keto is the cure. And remember, fatty cream, fatty butter, fat, that's the number one source of reducing inflammation. Let's see, we use a lot of Theralogics, Conception XR for the guys, vitamin D also for the guys, Theramegas, so the omega-3 fatty acids. They really help reduce inflammation. Really, really, really important. Lena Connor, how you doing? 2 tiny fibroids. Tiny fibroids. It's a hard one to know what tiny is, but if they're on the outside and small, leave them alone. But any large fibroids over 2 centimeters may be a sink of inflammation that is releasing these toxins all over the pelvis and the uterus. I think it changes blood flow. I think it absolutely is a negative factor. And more that I've seen, we take out a fibroid laparoscopically or mini lap or hysteroscopically, it helps with implantation. So I hope everyone's doing good. A couple more minutes, a couple of more questions answered. Again, a lot of what I wanted to focus on today is the powerful negative feelings we get even being on this journey, or when it doesn't work and we get angry at everyone and everything. And how do we help each and every one of us? How do we rein in and find kindness and love? Because remember, the words we use in our own brain, it affects us internally. And this is where I found the secret and the power of positive thinking and prayer and meditation and what you're reading and thinking and how you're sharing it. And I know at one point I had to just get out of some of the negative parts of Facebook that I know I probably was on. And in order to redirect my life and this whole process for all of us, and it doesn't resonate with everyone, but we still want to share a positive, loving, kind energy to everyone. Sandra Sue, how you doing? Jessica, Alicia, Natalie, let's see. What would be a good substitute without folic acid and Theralogics for my husband? Avoid folic acid, especially in supplements. Again, I personally don't take a lot of supplements because I really focus on I do a very powerful high fat, a lot of red meat, liver. It's with all the minerals and vitamins, and I don't eat the fruits, fiber, vegetables that really leach out, cause the inflammation, that remove it all from our gut, and create the inflammation in the body, which makes the bacteria and yeast love the colon, creates everything. Let's see. Jessica's asking in patients with the InvoCell. We haven't had very many, a handful. We do it. We'd be glad to help you with that individually. We've had one pregnancy miscarriage, but most people are not even going there because we feel that because we already are affordable, there's no value in that for most of us. And you can make frozen embryos out of the InvoCell also. And so for those that don't want to embryos cultured in an incubator in a lab, that's where the InvoCell comes in. Let's see, Sierra Moore, how you doing? First failed IUI. All right, always remember, you got to encompass the whole approach, the fertile secret. What you put in the mind, what you put in the mouth, and how you care for the body. Slow it down. And look at our supplements, Ovasitol, Ovavite, their omegas, CBD, and LDN. And remember, you got to look at whether or not it's got to be THC-free CBD, and you got to make sure through whatever jobs you're in, because some of them, they got to be real strict. You may not be able to use it at all. Fertile Hope Yoga with Aaron McCullough, home run. When women, guys come together, have the conversation, the fear and the worry, even the angriness, we have to let it out, put it out to the world, write it down, share it, but you got to steer it and redirect it on that path to the light. And don't give up, and don't forget laparoscopy, hysteroscopy, endometriosis, even for intercourse IUI cycles. It's the silent cause of infertility. And most people don't believe it, but it is amazing and true. All right, one more here. I see it's just turned 9 o'clock. And remember, share it out there Sundays, 8 p.m. Eastern Time, the Fertile Fireside Chat. And we're here even and share, hey, we got some people really hurting out there. What do we do? How do we help them? That's what we want to be doing. Even in the craziness of all of this stuff. And let's see. And again, a pleasure, Alicia, Latoya. We look forward to meeting everyone. We offer yoga in Syracuse, Albany, Rochester, Buffalo. But ask your fertility center or your OB/GYN doctor, or look around local, because you're going to find some low and slow yoga, cool yoga, that's going to cool the body. It's going to cool and redirect the blood flow to the core. Remember, when the body is cool, the blood flow goes to the core, and you need it in the core. Gratitude and blessings to everyone. Thank you so much for joining us. And in whatever pain is out there, let's share the positive. Let's all visualize and pray or meditate, whatever your form of tapping in to the infinite. God bless. Dr. Rob Kiltz, the fertile rocky road. We want to smooth it out and success it for everyone. God bless.